So we can all stand and jump to the launch of the COVID-19 Policy Brief 2019. The action is jumping now. So let's jump for the launch.
Launch. A better choreographed jump on the count of 3. 1, 2, 3. Or next small.
So the policy brief is declared launched.
Thank you.
And as a union, we don't just launch things, but we follow up on the implementation. If it happened, as much as we know that the spread of Omicron is quite rapid compared to the other variants, but if it happens that severity of it also is as high, then the healthcare of this country cannot manage and cannot handle the number of patients that will be seen. This is because the number of healthcare workers that are being employed in this country has not changed despite the waves of COVID that we are seeing. The number of hospitals, the ventilators, the ICUs, this has not been beefed up. So we're actually asking the government to actually employing doctors, employ nurses, employ clinical officers to make things work. The government's vaccination plan has been noble, but then there is no inclusivity, consultativeness, and even participation with all other stakeholders. And I believe this is what has brought up some of the demands or the recommendations that we saw from the Ministry of Health, where they were putting the issues of mandatory vaccination for everyone. But ideally, if that is changed and that there is participation by the civil societies, the trade unions, the associations, then members of the public will be more educated to accept the vaccines rather than being forced with them.
We are witnessing a rare case of evolution where the pandemic is changing face every day with little that is known, and our government as well stuck in the ruts and guardrails of an election that's upcoming. And we don't blame them because politics runs the country. They have to get power before they can concentrate. But before they set their house in order, it is imperative upon the associations and the various healthcare sectors and players to throw in the kitchen sink into this pandemic and make sure that nothing is left to chance.
What we have seen in public spaces, in consultative places, in devolution over the last 10 years is that consultation, public participation becomes more of a compliance rather than a commitment in spirit to why it's important. So effectiveness of vaccination plan undermined by exclusion of key stakeholders in consultations. 85% of our respondents attributed low vaccine acceptance and uptake to lack of meaningful and inclusive consultation with key stakeholders, including with healthcare workers and their unions, despite being key stakeholders. 72% of healthcare workers surveyed were dissatisfied, while 10% were very dissatisfied with the vaccination rollout process.